Here we are again with a quick question of the day, which is your INICET PYQ. It is based on the topic dehydration, which is again your very important topic for all your competitive exams. So here the question says, a 2-month-old boy who had been suffering from fever for the last 2 days was brought to the subcenter by his mother. The child weighs 2 kgs. On examination, it was discovered that the child was drowsy, skin pinch returned very slowly, oral mucosa was dry, eyes were sunken, forehead has 10 pustules. What actions should be taken at the subcenter? So very clearly we can see this is the case of dehydration. So this is the case of dehydration, and since the child is drowsy, it's a case of severe dehydration. Also, the skin pinch is returning very slowly. If the skin pinch would have returned slowly, it would have been some dehydration. It would have been some dehydration if the child was thirsty and eager to drink. Okay. So since the child is not thirsty and neither eager to drink, the child is drowsy and the skin pinch is very slow, it is the case of severe dehydration. Okay. Now the child has also, we can see from the question stem that the child has also been suffering from fever. So the child has also been suffering from fever along with dehydration. Fever plus dehydration. Also there are certain signs which are given in the question, like the child has 10 pustules on the forehead. Also the 2-month-old child weighs 2 kg, which is less than -3 standard deviation. So it also shows the failure to thrive. Okay, all these signs and symptoms point towards sepsis. It is pointing towards sepsis along with dehydration. So now what we have to do is we have to give antibiotics also for the fever component, along with the rehydration that has to be carried out in the child. Now here we can see from the questions that refer to the higher center with mother giving frequent sips of ORS. That seems right to me, so it could be plus minus, and we'll see the other options also. Now immediately admit the child, give IV fluids, and then refer to the higher center. This option is absolutely ruled out. It can be absolutely ruled out since the child is never immediately admitted. The child is always referred to the higher center where the child is admitted and given IV fluids. So this is definitely ruled out. Then your fourth option, we can see that the send child home with few packets of ORS and call after 3 days. So this option can also be definitely ruled out since we never send the child home with few packets of ORS. If it was the case of some dehydration, then we would have resuscitated the child according to plan B, and if it was severe dehydration, then we would have resuscitated the child with plan C. But we never send the child back home with few packets of ORS without resuscitating and called after 3 days. According to INICET guidelines, that mother is always advised to follow up after 5 days and immediately return if there is any dangerous signs occurring or if there is no improvement. Okay, so it's never 3 days. So option 4 and option 2 are ruled out just like that. Now moving to option 3, we can see that the first dose of antibiotic, give the first dose of antibiotic and refer to the higher center in an ambulance, giving sips of ORS along the way. So this seems to me the best option of all. So option 3 is your answer here. Now according to the INICET guidelines, your full INICET guidelines say that when the child is in severe dehydration, then we have to immediately refer to the higher center. Immediately refer to the higher center along with frequent sips of ORS on the way. So the mother has to give the frequent sips of ORS on the way. Also the breastfeeding has to be continued, and if the child is more than or equal to 2 years of age and there is cholera in your area, if there is cholera in your area, also give doxycycline for cholera. Also give doxycycline for cholera. So this is the complete INICET guidelines. Okay, So this is your question. The diagnosis of severe dehydration, and the answer is option 3, where we give the first dose of antibiotic and refer to the higher center in an ambulance with frequent sips of ORS according to the IMNCI guidelines. And we always have to answer this question according to the IMNCI guidelines unless and until mentioned otherwise. So this is your question of the day. Thank you and have a nice day, and stay tuned for more coming up next. Thank you and bye.